Welcome to Module 5. We're going to study the social and behavioral sciences. And I labeled this one Change is Tough. And we're going to look at the complexities of behavioral change. But before we do that, I want to kind of just review quickly to put these next couple modules in context where we cover both the social and behavioral aspect of behavioral change. We've talked about what public health is, right? It's about improving the health of populations. We've talked about epidemiology and the purpose of that in researching the who, when, and where of a particular disease or condition. We've talked about statistics and how that helps us make sense out of uncertainty. We've talked about the biomedical part of it that is just super exciting in that we are learning more and more about digging deeper into the molecular and cellular level and the genetic level to improve health outcomes. But as we put all those puzzle pieces together that we've talked about there, we may arrive at here is what's best for a particular condition, right? Here's what you're going to do. But let me put this out there. If all of that information doesn't translate into a behavior change, those people that are not practicing the greatest health, then is it really all for naught? So we're going to talk, and that's why I say that this how we can influence behavior or best influence behavior, because it's a tough thing to do. That these next couple modules are very important to your role in public health. So here's the question we're going to pose here: is do people choose their own health? Um, there are many influences, and I'm going to start by just suggesting that these are the leading actual causes of death. And what do I mean by that? Is that you might have someone that passes away from a heart attack, and the physician or the medical establishment or the doctor is going to say that was caused by plaque in their arteries and the subsequent heart attack. But in the public health area, we're going to talk about the real causes of death, right? The behaviors that happen every day that lead up to that buildup in plaque in the heart and lead up to the heart disease. So the real leading causes of death, and this is documented and justified, is the number one is tobacco. And we'll go through each of these top five, and you can see tobacco, poor diet and physical inactivity, alcohol consumption, microbial agents, toxic agents, motor vehicles, firearms, sexual behavior, and illicit drug use. Now we're going to go through the top five here, but here's what I'm going to suggest is that there's really no debate that those are the top ones there. So what we can do to influence behavior there, get people to stop smoking, is fulfilling our role in public health. So these leading actual causes of death account for almost half the deaths in the United States. Most are preventable. Most are premature deaths, and most are caused by individual behavior. Now, I want to address that for a second, caused by individual behavior, so not to sound like we're being accusatory in there. We're very complex chemical beings, and changing behavior is not easy. And we'll look at a couple of those things, both on the environment, our chemical makeup, and the social construct of our environment, how that in the built part of our environment, how those all influence, and tip the scales as to whether we may or may not be able to execute on the change that is better for our health. So let's go through the top five. Tobacco is the leading cause of death in the U.S. Causes cancer, cardiovascular disease. These are not surprises to anybody here, right? So again, the question we'll pose is that if that's true, if this causes all these bad things, why can certain people not change their behavior and stop smoking? Poor diet and physical inactivity. Now, this is one that, your book covers tobacco and then it covers poor diet and physical inactivity. After we go through this, we'll cover that in a little bit more detail, because I believe that it is already is a huge problem in our, at least in the U.S. I believe the number is 75% of U.S. adults are either overweight or obese. And when those cause poor outcomes, again, what can we do to help change the behavior for those people to help them fight obesity. Misuse of alcohol is the number 3 cause of death. You can read through those there. I mean, motor vehicle fatalities is number 1. The impact on the person themselves, chronic liver and disease, and you can see the others there. Number 4 cause of death is microbial agents. Now this is something we covered a little bit last week in the biomedical module, is that it used to be, things like influenza and malaria, and those used to be in the early 1900s one of the biggest killers. It says here, but we have been no means conquered, and evidence of that is, COVID-19 and resistance to antibiotics. Those have kind of reared their ugly heads again. I believe we'll through what we understand about medicine, what we understand about the history, we'll get that under control. But it's something we have to keep an eye on, and it may move from number 4, hopefully not. Toxic agents, it's number 5. It's actually a good story because that used to be much higher. In the last decade, we've done some amazing things to help clean up our air, help clean up our water, all those things that have helped prevent death. Now, in general, public health interventions are, fall into 3 categories. It's education, regulation, and prohibition. None of these are bad, and all of them are necessary, and we're going to go through each of those. One of the questions that I want to pose is it enough, right? Are these things enough, or are there other things that we could do that may influence behavior? And what I mean by that is maybe better understanding how human behavior works. So maybe those methods are more effective. Education, what do we do here? We educate on for example, smoking's bad effects. We recommend dietary allowances. Now, one thing I want to warn here is that I still believe that education alone is not enough. We have to, understand what sort of education, in what time frame, how other influences, which we'll talk about here today. You may tell somebody that's in an environment that they have little access to fruits and vegetables. You need to eat more fruits and vegetables to be healthy. That person won't be able to execute on the change of behavior because they don't have access to the fruit and vegetables, even though the education has told them that they need to eat those. So that's just one example. Other effective approaches include, and let's talk a little bit about the degree here. I mean, health education in schools, that does have some impact. Physicians' recommendations. This is getting better, but the reality is that physicians often don't have time to go into a deep lifestyle discussion. So even though that's good intended, I'm not sure that it happens as much as we would like to. I actually am part of a medical group that does a pretty good job of it, but only in the sense that they hand me a piece of paper that says, hey, Brad, here's the behaviors you should do. My doctor doesn't have the time or maybe even the full knowledge to explain to me exactly what they need to do. Using advertising as an approach, and then also a social norms approach. The social norms approach is effective a lot in younger people too. What it does is it takes people's misperceptions of the norms of a group and educates them on the correct perceptions. Like for example, let's say that in like high school age kids, that the advertisements by whomever is suggesting that, hey, smoking is cool. A lot of that peer group might not think that, and there can be advertisements or education that suggests that that's not cool, to try to overcome that idea that smoking is a good thing. Regulations, certainly these are effective. To the extent, again, is open to debate, but for example, traffic regulations to try to keep people from, going 100 miles an hour in a school zone. restrictions on alcohol, drugs, and tobacco, uh, laws requiring vaccination. All these things are regulations that can be put in place. And when you're working with the public health policy people, certainly is something that is worthwhile in pursuing. Now, we need to be careful here that we don't, over restrict. I mean, we haven't gone to the point, I mean, in the early, and we'll talk about this here in a second about prohibition. I mean, we can, prohibition didn't work. And so we can deny people certain things for the better health of the community, but there has to be a degree. Like, for example, do we not deny the entire population access to donuts because donuts is bad for your health and can lead to bad outcomes that then can lead to more hospitalization and higher costs for hospitals, right? You can see how it can get out of control and can, take away from freedoms that we might have. Prohibition, it actually proved that prohibition was effective in reducing alcohol consumption. If you go back and look at that, it didn't last because people said, listen, we should have the right to drink alcohol when we want. And, that is what it is. Prohibition against drugs, I mean, you can say they're effective. I mean, we can talk about, that the war on drugs might not be working. And I'll tell you, I mean, it's expensive, the war on drugs is, and, incarceration costs more than trying to help the person get better. So we may want to decriminalize drugs. I mean, I'm not suggesting that. I'm just saying that that's an option that may be less expensive and may be more effective and may be more humane for those people that, for example, are in prison for minor drug offenses. And I put here, just say no, the approach has not worked. There's a campaign, and some of you might be too young to remember where the big thing was just say no to drugs, right? That didn't really have a substantial impact on people's behavior. And so this week's discussion, and we're going to talk about the different behavioral models here in a second, but to what extent do you think people choose their own health? And what are some ways in which health is affected by factors not of one's choosing? So that second part here, we're going to get into right now and talk a little bit more about, how some factors that, again, are not of one's own choosing, their circumstance, how does that impact their health? And then I want you to contemplate, what you learn in school or what you learned in school about health-related behaviors. And do you think that health education classes were effective in influencing your behaviors? Again, just something to think about. Nothing you have to do formally there. And then also contemplate how many laws can you think of that regulate people's behavior for the good of public health? I mean, I can think of one here. Driving and drinking is the most obvious example there. So now I want to get into like how the psychosocial factors affect health behavior. And we'll go through a couple different health models here, and you'll have more information here on these to look at, some videos in your module that will give you a even better explanation than what we're going to give you here. And also understand that we're going to cover this like in a cursory way. So if you want to dig deeper, you can research it yourself, or certainly any sort of psychology classes or behavioral classes that you get at Grace will explore this more. So the most important predictor of of health is socioeconomic status, right? So I want to be careful about its socioeconomic status, but more so what that socioeconomic status results in. And we'll go into a couple of those here in a little bit, but one might be the built environment. And I'll give you an example I think I've given before, is that there's lots of research that suggests that like inner city housing is infested with rats. Rat feces, especially in young children, can prompt asthma. And so there's a person that didn't have a choice. They were living in housing that they were provided with. They were exposed to something that caused asthma, and so their built environment had an impact on their health in which they did not have a choice. So why the effect of socioeconomic status? Nutrition, and we'll go through each of these and give some short examples. Nutrition. There's certainly a bunch of studies that suggest, for example, I had done or looked at one a while back that looked at East LA, which is a lower socioeconomic place, versus Westwood in California. And what it showed was that there was almost 10 times as many fast food restaurants and 7-Elevens than in the lower socioeconomic than there was in the Westwood, the affluent area. There also was, and I can't remember the ratio, but there was less access to grocery stores, which meant there was less access to fruits and vegetables. Sanitation, we've done a really good job here pretty much across the board. I won't spend a lot of time on there. Conditions of the physical environment. We talked about the inner city thing, but also built environments in the sense of, are there walking paths? Are there bike paths? Are there parks where there can be some spontaneous exercise? If they're not, then the chance of them exercising is going to be less. Levels of healthy behavior, what they see around them, education, what they learn at schools, and also individual and social beliefs and attitudes. The environment that you grow up in, and we could get into great detail about like 2-parent households, 1-parent households, that influence, but what they see around them kind of forms their beliefs, and it also is going to form, there's suggestion that a person might have a fixed or a growth mindset, right? And all that can be influenced by those people that are around them that they grow up with, that kind of form that. And if you have a fixed mindset, you don't believe that you can change. And so that's going to influence our ability as public health officials to be able to change that particular behavior that we're trying to gauge. And it gets much deeper than that. The psychology does, but we'll leave it at that. Then also access to medical care. Someone either may not have insurance or they may not have great facilities in their neighborhood, so that also is impacted by socioeconomic status. So what sort of psychological factors? One of the big things that drives poor outcomes is stress. So again, socioeconomic status, somebody that is not worried about money necessarily. I shouldn't say not worried about it, but it is in a position where they don't have to worry about money, in a position where they don't have to worry about housing, or if they've lost a job, had a divorce, death of a spouse. All these things can increase stress, and those increase in stress causes physiological changes, increased inflammation, which then can ultimately lead to increased chance of chronic and sudden death from disease. There's a Alameda study that was done years and years ago that talked about the health risk of dying were strongly associated with the extent and nature of his or her social network. Things like do you have a church family, or do you have a social group that you interact with, that you're able to bump things off? Family members that you're able to talk to, and are you in isolation, right? Is that causing additional stress? So stress becomes a buffer, and higher income, education, and resources help just manage life's hassles, right? So there's something called Maslow's hierarchy of needs, where it talks about how people incrementally get higher to what's called self-actualization, where already your basic needs are met, your social needs are met, to where you can get to a point where you feel like you can give back your full self to the world. So that's kind of that idea that you have to get your basic needs met first, and then you progress along to get to a point where stress is lower. So this is an important thing to understand. Again, we might beat our heads up against the wall when we say, I don't understand. I educated this particular group. I told them that if they didn't make a change, that there was going to be some bad outcomes. It was supported by science, and yet they don't make a change. So this is a health behavior, the health belief model is something that people go through. And I want you to think through for yourself when you're thinking about making a change, if you don't go through some of these same things. So the first thing they do is they, someone is going to think, or even myself is going to think, am I susceptible? Am I vulnerable to the threat? So, you say to me, Brad, if you don't stop smoking right now, you're going to die in 5 years, right? So how much do I believe that I'm susceptible to that threat? And the perceived seriousness, right? That's dying within the next 5 years is pretty serious. So it might be something that I, you know, want to do. And then perceived benefit versus barriers. Is it worth it to not die, right? And what is it going to take for me to get there? What barriers are going to be in front of me, right? Am I going to be able to stop smoking, or do I have to have smoking? And then we're going to look a little bit deeper into the self-efficacy, right? Am I able to in fact change? So when someone says, "Hey, you need to change," it goes through all of our minds as to you know whether we have the ability to change, right? And this is all influenced by, I shouldn't say all, but in a great deal influenced by your upbringing, what people have told you in the past, whether you believe that you can accomplish certain things. And then the last thing here is that influences whether they're likely to change is cues to action, right? So I might have in the example I just gave you, if you don't stop smoking, I might have been having trouble breathing, right? I was super short of breath, right? So that might motivate me to change, right? Also, external cues to action. Someone else that a family member may have died from emphysema or from lung cancer. So that may influence you to change. Also, advice from others that you respect, a peer or what have you. So again, this is important to understand. I would do some more research on this because, again, it'll get rid of some of the frustration you might have if you're of the thinking that if I just give them the information, then for sure they'll change. And we're going to talk a little bit about that in next week in the module where we look at a book that's called Change or Die, right? And it really goes through and talks about people that were told, listen, if you don't change, you're going to die, and they still could not change change their behavior. So we'll look at that a little bit more next week. Here's just a bigger picture of that slide that we had there to the right. So let's talk a little bit about self-efficacy. Again, self-efficacy is the belief that one holds in their ability to accomplish a task. So that you have control over your life. It's increased if you've had previous success, right? And it's increased by seeing others successfully perform. So this last thing is why it's probably important, and it's been proven to be important that when you're trying to affect a change, that you have a partner, you have somebody that you can do it with you, and you can see their success and work through that. Some people get to the point of learned helplessness. It's a pattern where you're pretty much numb to a negative situation. So I am 50 pounds overweight, right? And I don't think that I have the ability to change it. So I just accept it and I say, listen, this is just the way that it is. Something else that I just want to mention is the growth versus the fixed mindset. And again, this is influenced by your environment as you grow up and continues to be influenced, where you can see people that have been successful and you think, hey, if they can do it, I can do it. So again, the fixed mindset is, listen, it is what it is. It's just going to be the same all the time. Where a growth mindset is that I can do something about it. So here is the different influencers of the level of self-efficacy. So positive or negative experience can influence the ability of an individual to perform a given task. If you perform something well in the past, you have more confidence that you can do it again. Um, yeah, and also through other people's experiences, you've seen somebody else be successful. So you look at that and you say, yeah, if they can do it, I can do it too. Um, Also by verbal persuasion, and this is where we come in, I guess, a little bit more is, uh, we tell people, listen, you can do this, right? You have the ability to do this, and we're going to help you get through that. Um, and then physiological feedback, when they start to do behavior, they feel better, or uh, they are start to see losing weight. They look differently, or they feel better. And so at the end of the day, that process like gets them going to the point where they can say, yes, I can do this. I certainly can do this. So again, you get a much better explanation and more encompassing. So another psychological model of health behavior is the trans-theoretical model. And what this does is it leads us through the different stages of change, right? And I think this is important to understand because you kind of have to meet people where they are, right? Not everybody's going to be at the same place. Uh, we'll talk a little bit next week about like motivational interviewing, just to give you an idea of, again, how you have to meet people where they are. But what this model does is it takes us through the 5 stages of change. The first is pre-contemplation, right? I'm not even thinking about it, right? I'm not even thinking about changing, right? It hasn't really even crossed my mind. The second stage is contemplation, where you're presented with something, you say, yeah, I'll think about it. It sounds like it might be a good idea, but I'm still not really ready to take any action. Um, the third part is preparation, where you're getting closer to enacting a change, right? And so you start to spell out what would it take for me to go from being 50 pounds overweight to a normal and acceptable weight. So that's the preparation stage. Then we have the action stage where you actually uh, take action and move through it. And then once you get into the habit of doing this and are seeing progress, then there's the maintenance stage, right? Where you just continue to do it and you maintain, or if you get to a healthy weight, you maintain that healthy weight. There is, part of this that's not necessarily part of the model, but there's the relapse, which would take you uh, back to the probably preparation stage, and then you would move through that again. So, and just one thing, this is not contradictory to the health belief model. I think it actually, works with that in order to help us better understand how we can help people move them to the changes that need to be made in their health. So I want to talk here about the ecological model of health behavior. And again, this is an important one to understand. And again, I'll go back to what I said earlier about how like education alone is not going to uh, influence the masses for change, right? It's important. I don't want to discount it that we need to know what is needed and we need to educate the populations on that. But one thing that we need to understand as a backdrop and things that some people don't necessarily have full control over is expressed in this ecological model. So let's go through each of these. So there's the interpersonal, the individual level, right? So uh, what sort of beliefs and attitudes does this person have, right? Is this a person that is uh, a fixed versus growth mindset? What are their attitudes towards change? What are their attitudes towards uh, you know life in general? So that's something that it operates at the individual level. Then you have the interpersonal level, right? I mean, what sort of influence do their families and friends and their social networks have on them? Certainly this is big and something that we shouldn't discount. I talked earlier about the influence of having a father in the home along with a mother, a two-family household, right? How does that impact people's ability to change behavior and or uh, move forward? The next is at the community level. Uh, we talked a little bit earlier about how important a church group or a social group are to reducing stress levels. So, if they have that, how much more likely, if they have support from a church, how much more likely are they to be able to move forward in that way? The next one is at the organizational or institutional level. Looks like I have a slide that's a little bit out of order here. The institutional level, organizational, that's going to be the institutions, the schools, the workplace. What sort of influence do you get from them? And then the last is the public policy level, right? So what sort of community or area do they live in? Do they have programs that help make things better for them? Again, we talked earlier about the availability to parks and that sort of thing. It's public policy that there's a certain number of open space per area, and how does that influence, or could this influence, a person's individual health? So this, again, I think it's important to understand that there are multiple factors that impact people's health. It goes all the way, again, from the interpersonal, the individual level, all the way up to the policy level, where the national, state, and local laws might influence whether a person has the ability or a propensity to be able to change. So changing the environment, it's usually more effective than trying to change individual behavior. And here's what I mean by that is that, let's again use the example of the availability of open space to exercise, or the availability to different sports programs so they can exercise. For us to just go to this individual and say, you need to exercise more, without providing them the access and the facilities to do that, is an empty exercise, right? And that it's going to be unlikely, if they don't have a place to exercise, they don't have the opportunity to exercise, and they don't have the facilities to exercise, that they will actually exercise. So that's what we're talking about when it's more effective than trying to change the individual behavior. It was pioneered in injury control programs, right? So we try to make the environment more safe, rather than just tell the person, hey, you need to do A, B, and C. Is effective in tobacco control programs, and is now being considered for diet and the problem with the decrease in physical activity. We talked a little bit about that right there, is where, again, if we build it, they will come. If you offer opportunities for them, they're not even thinking about the exercise they're getting. They're just having a good time, and there's a social community aspect to that also that is very important in promoting their health. And again, this is where, again, socioeconomic status, again, it's not it's what they have access to necessarily, versus just whether they have enough money to live or survive. Again, access to area where I live in, access to like youth programs and places where they can go and get exercise and get community are readily available. If that's not readily available, then it's a challenge for that particular area and for that population to be healthy. This is something to contemplate. Describe 5 ways in which the high socioeconomic status contributes to good health. We've talked about a few of those here. Discuss how social support can protect against the health effects of stress. Again, just contemplate that. Do a little bit of research if you'd like to on that. And how could the concept of self-efficacy be used to lead a class in a weight loss program? So you want to contemplate that. And then, this is something you're actually, I would say, use the ecological model to explain why the U.S. has a high rate of adolescent pregnancy. And discussion question 6, you can look through here. And this is actually, I want you to contemplate this one there. So we're going to dig a little bit deeper here into the poor diet and physical inactivity. So we've talked about, the challenges with getting behavioral change, and we're going to look now at specifically this growing problem with obesity driven by poor diet and physical inactivity. Health risk of obesity, cardiovascular disease, diabetes, some cancers, arthritis. I would suggest that just in general, you don't feel as well, your body doesn't work as well, especially if you have diabetes. It really, can cause some severe issues where you're not living your best life. BMI, I wouldn't suggest this is a perfect measurement, but it's one that helps us understand, where we are in the spectrum of being overweight or obese. So I want to show you the epidemiology of obesity. And I put here a little changing chart here that shows the progression of obesity. And this should cause us all alarm. So I'm going to wait for it to get back to 2011. And as you can see, the dark red is the worst. So we start in 2011, no dark red at all. 2012, no dark red. 2013, some dark red. 2014, more dark red. 2016, more. 2017 more, and 2018, 2019 even worse. This is a problem, and when you look at the Healthy People Initiative, this is a problem that is getting worse, right? I mean, we have 74.6% of the men who are overweight or obese. We have, especially an issue with Black women, and something that certainly should be researched on a deeper level as to why that population is more impacted than. I mean, I have some theories, but certainly leave those for another day. White men are slightly more likely than Black men to be overweight or obese. I mean, why is that way when for Black women it's more likely that they're obese? And as you might understand, I mean, higher socioeconomic status associated with lower rates of overweight, obesity, and especially among women. And I would suggest that that's several factors that influence that. Access to good foods, enough money to buy good foods, access to built environments where you, again, can go out and walk in a park, safely. All those things are going to influence whether. But even that said, even though we're an affluent nation overall, the problem continues to persist. So what can we do to help shift this this tsunami, if you will, that is causing many health problems in our country? Here's the same thing if you want to look at that in a bigger visual right there. So again, you can see as we progress, and even the yellow is 25 to 30%, right? That's a big number of people that are obese. This is not just overweight, which also can have an influence. These are people that are obese in the United States and the various states. So this is another challenge, is that we have a greater deal of overweight among our children, right? It's growing. And, we have, sooner onset of diabetes, sooner onset of obesity. And there's lots of influences here. One of the things that I think is probably a huge influencer is that we're less active. And part of the reason why we're less active is that we have, more access to screen time. And, our phones are a challenge for our kids because they're, either engrossed in video games. And I'm not doing this as all encompassing that, but they have the opportunity to be more, spend more screen time and sit around more. That's kind of become our norm with the access to mobile phones or iPhones or however we want to describe those, that they do so much for us, but they also can cause us to be less active. So diet and nutrition, again, what I'll say about this is that this is education. But if we're doing education, why is the problem getting worse? So that's a question I want you to ask yourself is so there's access to what it is and what you should do in order to be more healthy and to eat a better diet. What are the influences that are keeping us from being able to do that? And here's something that is not surprising to me. Diet of about 75% of the U.S. population falls short of the federal recommendations. not a question as to why we have the issue. And this is just one part of it, right? The diet, but I would suggest it's an intricate part, right? Our bodies are so amazing in dealing with what we put in our bodies. And listen, I don't necessarily put it all on the food companies. I mean, they had we used to have a hunger problem, and they've created like so much food that had to be mobile and it had to be preserved and had to be all those things. But the end game is that those sort of processed foods now are identified as some of the causes of obesity and stuff. So again, we don't blame the food companies necessarily for bringing those on in some instances, but we certainly want to discuss ways that we can be more healthy and maybe eat less of the processed foods and more fresh fruits, vegetables, and great proteins. And here's something that, and I'll tell you a little bit about my story, is that I grew up drinking the 16-ounce glasses of Mountain Dew. And at one point, I think it was 15 years old, I had to go to the doctor because I had this running heart rate. And so he says, listen, you're drinking too much Mountain Dew. So I stopped drinking then. I continued to drink that periodically into my 40s. About 15 years ago, I just gave up soda. And I would tell you this is that, and there's more research around this, is that when I gave that up at first, it was hard. But as I continued on with that, as the years passed, it almost became, when I didn't have it, when I drank it later on, it didn't taste the same. It didn't taste as good, right? It tasted too sugary to me. So my body composition, I'm telling you, changed, where I put the time in. I didn't drink it. I drank it periodically, but eventually I don't drink any soda at all now, because it doesn't taste good to me. It doesn't make me feel good. I understand why people drink it, because it is good. It's full of caffeine, makes you feel good. But if it's 7% of our daily calorie intake, that's 7% of empty calories that we're putting in our body that are not really feeding us nutritionally in that area. So promoting healthy eating, again, a lot of this is education, but I mean, many social, cultural, and economic factors contribute to dietary patterns. And again, some of this stuff is not bad. I mean, you might have a social construct or environment where that particular population or ethnicity, puts a big value in these large meals and getting together, which, again, I encourage people getting together in a community, and lots of times that's around food, right? So it's tough to say, hey, you're going to come, and before you had, all this great food, whatever it might be, flautas, etc. But now we're going to have spinach salad, right, this time. And that's not going to necessarily happen. It has to be a gradual process. But anyway, that the social construct or the cultural things does impact that. And that's not necessarily a bad thing, right? They're getting other things from that. Learning from tobacco control success. I mean, there has been success. It's taken a long time, but education has helped, and the warnings on those have helped. Enhance self-efficacy and provide social support. This is something that's important, again, is that someone's self-efficacy improves when they see others be successful, and they see they're encouraged that they can be successful also. So the communication that we give as public health officials needs to be of that ilk, that we are saying, listen, you can do this. I know you can do this. Here's somebody else that did it, right? You can do it just as well as they can. California's 5-a-day campaign for better health, that was 5 vegetables and 5 fruits a day. Increase access to healthier food options. Certainly that's a continual process. We have several food companies that certainly, suggest that they're making food healthier. I'm not sure to what extent they are, but certainly there are efforts to make healthier food options in schools. And again, reduce less healthy foods in public venues. High calorie drinks like we talked about, the sodas, fast food in schools, and limit or tax sugar sweetened beverages and junk food. That does show to be effective. It might have a more of a profound impact on those that have less money to pay for things, but that is for debate. So what can be learned from the tobacco control programs? This is provide more food labeling. again, I'm not sure. It's been probably 10 years since they started putting calories in on like food menus, et cetera. At least out here in California, we're required to. It does make me take a second look, but I'm somebody that's aware, and I don't know that most people pay attention to that, but maybe they do. But anything we can do to help people better understand what's in the foods that they're eating, I think is an advantage. Um, Limit advertising of unhealthy options, especially ones that are aimed at children. Uh, Again, there's work towards this, but I'm not sure the progress we've made in the last couple decades. Um, and the best hope is to focus on our children, right? Those are the people that are at the beginning of their lives, and anything we can do to encourage healthy habits is positive. And again, the health of people in lower socioeconomic group might tend to help us believe that either parents aren't promoting healthy eating or they don't know any better. Whatever that might be, it certainly helps to start when they're younger. So physical activity, again, I'm not going to spend a lot of time here. We all know that exercise helps us in our physical health, and I also will tell you that it helps in your brain health, right? And how smart you are. Now, I told the story before, but I'll tell it again. There's unbelievable research that our brains can grow, right? We used to think that by age 25 our brains were fully developed, but now we're told our research suggests that our brains can continue to grow into late age, right? And part of the driver of that is exercise, right? So when we exercise, I used to tell the young kids that came to our basketball program, I used to tell their parents that that I'm going to help make your kids smarter. And we did that by keeping them active and keeping them moving forward, and really just is going to promote a better overall life, not just in helping your physical health. And what I mean by that is, how you look and how much you weigh, but also your brain health is going to be impacted by that. So how much exercise? These are recommendations that you'll see. I'm not going to spend a lot of time on that. You can look through those and decide what is best for your particular situation. And again, it's always suggested you talk with your doctor. It's up to you. I mean, certainly before you start any activity, if you've been inactive for a long time, that you should speak with a doctor first or someone that's in the know. So promoting physical activity, we want to promote the ecological model, and intervening at several areas of influence, right? Again, at the individual level, whether they think they can exercise, at the family level, how are they promoting different things? Are they getting community in there, right? Are they getting support in their exercise? All the way down the line at the school level, do they offer, sports programs and intramurals to not just the best athletes, right? Do they offer them to anybody so they can get exercise? We've talked about the built environment, you know, sidewalks, walking trails. This suggests you the pedometers, and I have a pedometer. I don't even think it's called a pedometer anymore. It's like on your iPhone, right? That measures lots of great things: how fast I walk, how many steps I take, all these things that are helpful to like promoting accomplishment and that you did something great. And develop habits of exercise in children and adolescents. Super important, right? And I don't know that we've done a great job of this, in that we tend to focus on the academic piece of it, not understanding that if we would break away for exercise, again, that's going to help them develop their brain, that's going to make them smarter, make them more alert, and increase their performance on the academic side. So again, confronting the obesity epidemic, they're suggesting now that our life expectancy will come down because of the obesity epidemic, right? It's been going up, up, up. They're saying life expectancy will decline. Also, almost 21% of the total medical expenditure is as a result of people being obese. And I'll add to this, I mean, the number one predicting factor of someone that will have a bad outcome from COVID is obesity. So this is an important thing, and we certainly need to make sure that we continue to fight this challenge. So I want you to contemplate, what are some of the environmental factors that discourage Americans from eating healthy diets? I will give you, I'll give you one. Actually, I already explained that there were the environment in one city versus a neighboring city was so different that that their environment, certainly would influence their ability to eat a healthy diet. So just contemplate that and think that one through. So next week we're going to talk a little bit more about more geared towards individual behaviors. We're going to look at again, that Change Your Diet book shortly. We're going to look at a little bit more into the motivational interviewing and the the different stages of change. We're going to look a little bit more deeply into, and that will be a short one because we covered quite a bit here in this week. We've been almost 50 minutes here. So we will cover some more on how we can influence behavioral change next week. All right, have a great week. Take care.